Welcome back to Mastering Medicare, the series where we break down Medicare into simple terms so you can avoid costly mistakes and make informed decisions. I'm Dr. Lance Coss, your host for this series. If you haven't watched episode 1 yet, I highly recommend you go back and start there because today we're building on a big myth we busted last episode, the idea that Medicare is free. Well, here's another reality check that goes right along with that one. Medicare doesn't cover everything. A lot of people think that once they sign up for Medicare, they'll never have to worry about another medical bill again. Unfortunately, that's just not how it works. Medicare is a government-run insurance program, but like any insurance program, it still has rules, limitations, and exclusions, and if I'm being truly honest, there's a lot of them. Just as you wouldn't expect Humana, Blue Cross, or any other private insurer to cover every single medical expense, you shouldn't expect Medicare to either. So now before we dive into what Medicare doesn't cover, let's talk about what it does cover, because for most people, it provides a solid foundation for healthcare coverage. Medicare Part A. Medicare Part A covers hospital stays, skilled nursing facilities, not long-term, we'll get that in a minute, hospice care, and some home health services. Medicare Part B. Medicare Part B covers doctor visits, outpatient care, most preventive services, a lot of diagnostic tests, and durable medical equipment, which are things like your oxygen, your walkers, your wheelchairs, other medical supplies. Medicare Part D. Medicare Part D covers prescription drugs, but only if you enroll in a plan. This is all great coverage, but there are some big gaps here, and those gaps can lead to some serious out-of-pocket costs if you're not prepared. So let's talk about some of the biggest medical expenses Medicare won't cover. These are the ones that catch a lot of people, like my very own mother, completely off guard. Let's start with the long-term care. Well, Medicare will cover short-term rehab in a nursing home, but it won't cover custodial care. So if you need long-term nursing home care or assisted living, you'll need to pay privately or have other coverage like Medicaid. So let me clarify the difference because a lot of folks get this confused. What do I mean by long-term care? Long-term care refers to ongoing care in a nursing home or assisted living facility for people who cannot live independently due to chronic conditions, but it is not covered by Medicare. Custodial care. I get this one every day. Custodial care is non-medical assistance with daily activities like bathing, dressing, and eating. That means since it's not considered skilled medical care, Medicare will not cover it, even if it's being provided in a skilled nursing facility. Skilled care. This is medically necessary care provided by licensed professionals, so think your nurses, your therapists, and it is typically covered by Medicare Part A for a limited time, but there's a big but here. You can only get your skilled nursing care covered if you meet the 3-day qualifying hospital stay rule and some other requirements. So let me break that down, and here's how it works. What is a 3-day qualifying stay? To qualify for Medicare-covered care in a skilled facility, you must have been admitted as an inpatient in a hospital for at least 3 consecutive days. That doesn't count your day of discharge, and it doesn't count any time spent in observation care. The hospital stay must be medically necessary and related to the condition requiring your skilled nursing facility care. You also must be transferred to the skilled nursing facility within 30 days of your hospital discharge for the same condition. If you are lucky enough to get your skilled care covered, how long does it last? Well, once you meet the 3-day hospital stay requirement, Medicare Part A covers skilled care for up to 100 days per benefit period, but keep in mind that coverage is tiered. What do I mean by that? I mean that days 1 to 20, you're fine. Medicare will pay 100% of your skilled nursing facility costs. What happens after day 20? Well, from days 21 to 100, you will pay a daily copayment, which right now in 2025 is $209.50 per day. After 100 days, you're on your own. Medicare stops paying completely and you become responsible for all costs. So if you need skilled nursing facility care that lasts beyond 100 days, you'll need to either get on Medicaid, get some long-term care insurance, or have some pretty deep out-of-pocket funds to cover those costs. It's important to note that these costs do reset with each benefit period, which begins the day you're admitted as an inpatient and ends after you've been out of the hospital or skilled nursing facility for 60 consecutive days. So, what are the 4 key takeaways for understanding skilled nursing care? A 3-day inpatient stay is required before Medicare will cover any skilled nursing care. The care must begin within 30 days of the hospital discharge for the very same condition you were admitted for. Medicare will fully cover the first 20 days, and co-days begin to apply from days 21 to 100. If you stay longer than 100 days, coverage ends, and that's per benefit period. So bottom line, Medicare only covers short-term medically necessary skilled care or rehab, not any long-term or custodial care. So if you require ongoing assistance with daily living, you will need private insurance, Medicaid, or you better have some good personal savings to cover those costs. So what else doesn't Medicare cover? Let's start with dental care. Routine cleanings, fillings, dentures, Medicare doesn't cover them. If you need dental work, you'll either need a separate dental plan or you're going to pay out of pocket. How about vision care? Need glasses or contacts? Nope, not covered. There is an exception here, however, for after cataract surgery. Medicare does provide some limited coverage for vision-related expenses, but only under specific conditions. What are they? Well, Medicare Part B will cover cataract removal and the cost of a basic intraocular lens, which is implanted to replace the eye's natural lens. Medicare Part B will also cover one pair of standard eyeglasses, basic frame here, nothing designer, or one set of contact lenses if they're considered medically necessary after you have your cataract surgery that did include the implementation of the intraocular lens. Medicare will also cover the necessary exams and the doctor visits related to the cataract surgery recovery. And Medicare Part B will cover some post-surgical medications, but only if they're administered in a doctor's office. If you need prescription eye drops for at-home use, those are going to be typically covered under your Part D Medicare prescription drug plan. So here's one that got my mom. What about hearing aids? One of the most shocking gaps in the Medicare program is that Medicare does not cover any hearing aids or routine hearing exams. What about cosmetic procedures? Thinking about getting a facelift? Medicare says no, not unless it's medically necessary. And I'm going to be honest with you, even then it's going to be a pretty tough sell to get that one covered. This last one's a big one and catches tons of people off guard. If you're traveling outside the United States, Medicare does not cover most medical expenses abroad. So if you travel frequently, you better consider a supplemental travel medical insurance policy. So what do you do about these gaps? Well, you got some options. Some people find by switching to a Medicare Advantage plan, which you'll remember is Medicare Part C, they can find plans that offer limited dental, vision, and even hearing benefits, but coverage does vary, so shop wisely. Some people like to buy Medicare supplement plans, which are widely known as Medigap policies. These help cover out-of-pocket costs, but they do not typically cover dental, vision, or long-term care, so again, shop wisely. There's also standalone insurance plans that are offered to many seniors, and many retirees will buy these so they can buy separate dental, vision, or long-term care policies just to fill these gaps. Now, how about that health savings account that you've been putting money into? Well, if you save money in the HSA before enrolling in Medicare, you can use those funds to pay for dental, vision, and hearing expenses tax-free. However, once you enroll in Medicare, whether it's Part A or Part B, you can no longer contribute to your HSA. To avoid tax penalties, stop HSA contributions at least 6 months before enrolling in Medicare, since Part A coverage can be retroactive for up to 6 months. So proper planning ensures you can maximize your HSA benefit while avoiding unexpected tax liabilities. So while Medicare is an essential safety net, it's not a comprehensive health plan. Understanding what's covered, and more importantly what's not, can help you avoid unexpected medical bills and those costly mistakes. Well, that concludes this episode. In our next episode, we're going to tackle one of the most expensive mistakes people make when signing up for Medicare: missing your enrollment deadline. Trust me, these penalties last a lifetime, so you don't want to miss that one. So, like always, be sure to subscribe and like below, or drop me a Medicare question at lancecost.com, as I'll be answering them as we continue throughout this series. So thanks again for watching Mastering Medicare. I'll see you next time.